before Self-Fund Health, first of all, we were fully insured, meaning we had a broker. The broker went out to the Blue Cross Blue Shields, United Healthcare, etc. And basically they negotiated how much of an increase we would get on a year-by-year basis. You never really felt like you had any control over it, and really what your goal was to negotiate the lowest decrease. And sometimes that meant stepping back and going, okay, what triggers are we going to pull? Are we going to reduce? Are we going to increase deductibles? Are we going to increase copays? Are we going to narrow our networks down? So it was always about trying to take away options from our employees and from our plan, just in order to control cost in some way. And again, not about reducing cost, but reducing the amount of increase that we were going to end up getting in that year. As we transition from a fully insured plan to a self-insured plan, one of the first steps originally in my mind was to go through a self-insured plan, which is pretty much the same as the big box plans, but the only difference is now you had access to the data. And that's kind of what you're sold on when you convert from fully insured to self-insured, is now you're going to have access to the data, which is great, but what do you do with that data when you get it? Are there any tools or mechanisms you can use to actually improve your situation? So when we first looked at one of our options for going self-funded, it was very much in the traditional healthcare model or health insurance model. The only difference is now you had access to data, and then maybe you could gain some additional discounts by, again, narrowing down your choices or your employees' choices. And so it didn't seem like a big step. It was a step in the right direction in that you had access to data, but it didn't give you any tools to do anything with that data. And there were also certain restrictions on that, so you didn't have full control over your healthcare plan. With self-funded health, you not only did you get access to that data, they also provided many tools for you to actually act on that data to affect your outcomes. So you definitely felt like you had more visibility to the numbers, but more importantly, you had some control over the outcomes. Self-Fund Health approaches self-funding in a very different way. What I mean by that is that, yes, they give you access to the data, access to the claims, but they're also providing you with a structure. So many times if you're going to go out on a self-funded and you want to do individual contracts with different providers, you want to work with a pharmacy benefit manager, and there's a lot of parts and pieces, a direct primary care provider, and you can go out on your own as an employer and develop those relationships, create those contracts, but it is an awful lot of work. And most organizations don't have the resources to be able to put those contracts in place, meet with all those providers, vet them out, and Self-Fund Health kind of offers a one-stop shop. I guess my biggest concern in making this leap that we did, because we kind of leapfrogged their traditional self-funding insurance. We went straight from fully insured over to what is considered in many circles a radical shift, where we had this group of independent networks, and that as a company, we were paying 100% of the healthcare costs if our employees chose to use this independent network. But the model only works if your employees utilize it. So my biggest concern in this was, are we going to be able to educate and communicate enough to our employees to convince them to take that first step towards seeing a direct primary care provider, changing who their original doctor was to a new one. So if you don't get utilization out of the plan, then you really haven't changed anything in this particular model. So my biggest concern is making sure that we did our part from a communication, education, and marketing to persuade our employees to take that first step. The biggest thing that surprised me about the switch to Self-Fund Health is really the education on what was going on in our current healthcare system, and the fact that you actually do have more control over your healthcare and over healthcare outcomes, but you have to dig in and you have to educate yourself on it. I really didn't care much about knowing what was going on within our healthcare system, other than to complain about the cost of it and the lack of control over it. But the one thing that Self-Fund Health plan does is give you transparency to the true cost in healthcare. When I was able to actually look at the cost of a knee surgery. One of our employees had a knee surgery, and we get a savings report each month, and knee surgery that would have been performed in one of the big box systems would have cost the plan $27,000, and it would have cost the employee their full out-of-pocket maximum, which was $6,000. As a result of going to our independent provider network, it cost the employee zero. So the plan covered the cost 100%, and the plan actually paid $5,000 for the procedure. So the biggest thing that surprised me was the fact that you had visibility to the true cost of what a healthcare procedure was and how much really overhead and non-healthcare related costs is built into a billing from one of these big box systems. Yeah, so this was our first year, and I've kind of avoided, when people have asked me during our first year, how's it going? And, have you fully embraced it? Would you recommend it? And it's so hard in the very first year to really draw conclusions early on. So we completed, 2024 was our first year. And I've been monitoring it along the way, and I've just kind of been thinking, okay, this is too good to be true. Something's going to happen. It's going to, at the end of the year, I'm going to be presented with a lot of costs that, I wasn't expecting. And nothing could be further from the truth. So we probably saved somewhere between $800,000 and $900,000 in our plan by our employees accessing our preferred provider network. And the employees have saved probably close to $200,000 in deductibles and copays by utilizing that. Yeah, employees initially, when we launched this plan, I think were very skeptical, especially when we presented to them the fact that if you used the independent provider network, it would cost you zero. That in and of itself sounds too good to be true for anyone, myself included. And so I think initially our employees had a lot of skepticism in it. And let's face it, people hate change. It's a radical change to go from one of your big box doctors to a smaller building, smaller structure, less people in the room, less overhead, a new faces. And so skepticism, I think, was the initial concern. And one of the reasons why we did the incentive was to get people engaged in it. We did the $100 bill incentive. So if you saw one of these direct primary care providers, you got a $100 bill. But for us as the plan, we knew this was the way that you were going to access our healthcare plan. And once you got comfortable, and so the way it kind of worked is employees first started with their direct primary care provider. That was whether that's scheduling their annual physical, getting their blood work done. So that's kind of that first baby step to get your employees less skeptical and kind of embracing parts of the plan. The next step is that once they have some kind of ailment or a procedure that needed to be done, we didn't see them immediately going, hey, if I needed a knee surgery or something like that. They didn't just jump in with both feet due to the skepticism. But I did see a lot of people needing MRIs, needing x-rays, needing annual colonoscopies. So that was kind of that next step that employees embraced. So we went from the simple direct primary care annual physicals to more of your diagnostic procedures, very, low risk type things. And each step along the way, the employees realize, hey, so I'm not incurring any out-of-pocket costs for this. So that encouraged them to take that next step. So you go to direct primary care, that gets you to now diagnostics. And then now if you need something done from diagnostics, takes you into the world of surgeries or different type of procedures. So you've now kind of gained some confidence that the healthcare, that it's not too good to be true, that so far, between your direct primary care and your diagnostics, you paid zero. So now let's meet the surgeons that are part of this independent provider network. My advice to anyone that's considering a switch, whether that's from a fully insured plan to a self-insured plan or from one self-insured plan to the self-fund health plan, is to educate yourself and to listen. Be prepared to be educators, communicators. So if you really want a structure where you just kind of set it and forget it, this plan may not be the best for you, but recognize that your outcomes are going to be very similar to what you had today. So if you want something radically different in terms of your outcome, being the cost of your healthcare plan, the cost to your employers, the employees. You're going to have to do something different and be willing to take that first step. But you are going to have to be prepared to educate your employees. First and foremost, you got to educate yourself. I was not I couldn't tell you anything about the healthcare system, and now I'm a healthcare nerd when it comes to trying to understand, cost in our healthcare system and what drives it. But you are going to have to this is not a plan where you set it and forget it. You need to market it. You need to communicate it. You need to tell your employees what you're doing, why you're doing it. So be prepared to take some ownership. That's probably my biggest advice to you, is that this is not a set it, forget it kind of plan. This is one where you take ownership of it, and like anything else, you get out of it what you put into it. With Cellfund Health, they're a true partner to us. Anytime I need something or one of our employees needs something, they're a phone call away. They work with a lot of our providers within there. So if there is an issue, they jump on it first and foremost, and they don't let you think that you're out there on an island. They recognize that the model is different and new, and all they care about is the success of their clients.